Good morning and welcome to everyone from the Senior Law Day Collaborative. My name is Elena Falcone. I'm the Director of Public Innovation and Engagement at the Westchester Library System, and I'm also the happy co-chair of the Senior Law Day Collaborative. I share that responsibility with attorneys Sarah Steckler of Keene & Bean and Melinda Bellis of the Legal Services of Hudson Valley. Let me tell you a little bit about the Senior Law Day Collaborative. We are a collaborative of more than 150 professionals who are super eager to provide a free, authoritative information and guidance on legal, financial, and health topics to our county's older adults, especially in these challenging times. To that end, we've recently retooled a lot of what we would normally do in terms of large, long full-day events with workshops and consultations to providing an extraordinary amount, actually, of content on this platform of Zoom. And all of these webinars that we've been doing are recorded and are posted to our website, which is something I want to share with you. So I'm going to ask my colleague Bruce to bring up the Senior Law Day website. It's seniorlawday.info. Neglected to introduce Bruce Siegel, who's the marketing consultant with the Senior Law Day Collaborative. Seniorlawday.info is your go-to resource for following up on all of the information that you hear today, and also for asking questions of those more than 150 professionals who are eager to share their knowledge with you. The Senior Law Day Collaborative website is, I hope, easy to navigate. It's got across the top a menu that tells you everything that you pretty much need to know. Today's webinar will be posted to that 2020 webinar page, and that's where you can find all of the webinars that we've done so far on topics that you can use today. And included with those webinars are any of the presentation materials that folks have shared. Additionally, the Senior Law Day Collaborative website has the Elder Law Q&A. You would say that's our sort of premier publication. It's an annually updated resource that we produce both in English and Spanish. And Bruce, if you'll scroll down that page a little bit more, you can see that it is an introduction to aging issues and planning for the future that covers all of the topics listed there, wills, trusts, healthcare proxies, etc. And it also has a fairly rich appendix. It has all the forms that you need to fill out. In addition to the Elder Law Q&A, I want to draw your attention to the Ask Us button that you'll see on the right-hand side. The Ask Us button is your opportunity to ask us a question. So following up on today, months from now even, you can come to this website, seniorlawday.info, and click on that button, and you'll be able to get a response from us within 2 business days by either email or phone. We can follow up on any of the topics that we cover here today, and anything that you see listed on this website. The other thing I'd like to bring to your attention is on the main page, there's a big call out that there's information on this COVID-19 universe that we're in. We've curated, the library system has curated links for authoritative information that is kept current, that is relevant particularly to Westchester County, New York State, and nationally. So I hope you'll come back to the site after today. So again, before I turn you to our presenter today, I want to talk about the environment in which we're in. So Bruce, you can stop sharing the screen. So we're recording in Zoom. So that means that we have the opportunity to post this site afterwards, to post this whole recording afterwards. You are muted today, but you have a voice. So you have a Q&A button that should be at the bottom of your screen, whether you're on an iPad or a phone. You may have to tap 3 little dots to get to that option. Please use that Q&A feature. If you have questions today, you can pop them in there. We're going to be monitoring them and make sure that they get addressed. If for some reason, since we have a lot of attendees today, we can't address them live right now, be confident that we will follow up with you. The one caveat is that if you ask your question anonymously, which is an option, then we won't be able to have your email address to be able to respond. In which case, what are you going to do? You could always go to seniorlawday.info and ask your question there. Anything else? No, with that, what I want to do is turn you over to our presenter today. David Cutner is an acclaimed elder law attorney he's a partner in Lamson and Cutner. And he's going to be talking today on Medicaid Redesign, how to protect your assets and still apply for care. David has been a powerful and popular feature of all of our Senior Law Day programming. And David, I have to say, I'm always moved by how after your programs, people come out of their sessions and going, now I understand. Really, David, that is an amazing accomplishment. And so I'm so glad that you're here today to share that with everyone. So David, take it away.
Okay, thank you, Elena. It's nice to be here at Senior Law Day. As you know, I've presented a number of times at the Senior Law Day events, and this is my first time on Zoom. And I imagine for all of you out there, your first time at Senior Law Day on Zoom. So let's make it a success today. I'm sure we can. I'm going to share my screen with you. Let's see, there we go. That's me. I'm not going to spend too much time on that, but that's where I am. So, you know, while we've all been paying attention to the coronavirus and all the news has been about the coronavirus, the New York State Legislature has been hard at work and slipped into the budget some dramatic changes to our New York Medicaid program. Medicaid started back in 1965, so we're now, I think, in our 55th year of Medicaid. Medicaid is a program that is a joint program, a partnership between the federal government and the state government. And the state governments, the state's contributions are so important. You know, those states have put little into their programs, of course, have very modest or minimal programs. New York, on the other hand, has always been the leader in Medicaid. We have the most robust, best funded, most friendly program, most accessible program of any in the country. And I think by far, from what I've seen, way ahead of most other states by enormous level. And one of the great features about New York Medicaid has been the lack of a look back for community Medicaid. And I'm going to explain the look back in the program today. But here you have on this slide an indication of what the legislature was up to. And I'm sure that this is all motivated by the budget constraints that are arising from the coronavirus, because you know the idea of a look back for community Medicaid has been raised numerous times by other governors long before Andrew Cuomo, and every time it's come up, it's been rejected. But it came back, and here we have to deal with it. So I'm going to start today by giving you a hypothetical situation, mom's financial position, and I'm proposing that she's renting a home in somewhere in Westchester. She has some savings. She's a retired school teacher. She has some Social Security and a pension. And I'm going to take a look with you at how Medicaid deals with nursing home, because we have a look back in place. It's been in place for a long time. We know how it works. So let's take a look how it works in the nursing home context. And then we'll go take a look at the community Medicaid context. All right, so someone's in a nursing home and is eligible for Medicaid. That person has no more than $15,750 in what Medicaid calls resources. So your resources are essentially your financial assets and real estate. We're not going to look in your jewelry box or your garage or your stamp collection or your tangible assets, but no more than $15,750. That changes a little bit every year. That's what it is this year. Medicaid doesn't ignore income, but it's not a factor in eligibility. If you're in a nursing home, you get to keep $50 a month, and the rest is NAMI, net available monthly income, that goes to the nursing home. So in the nursing home context, though, we have a look back. If you're asking Medicaid to pay your bill at the nursing home, Medicaid wants to see what you have done with your money for the previous 5 years. This is the so-called look back. And the idea of a look back is, you know, Medicaid really doesn't care how you spent your money. It's your business. You know, if you bought an 80-inch flat screen TV with surround sound, nobody's going to say to you, gee, you know, couldn't you have been happy with a 42-inch TV? It's really not their business. What they're looking for is whether you have gifted or transferred money to a family member or a friend or a trust. And the idea of it is, if you have money to give away, that's money that you could have used to pay your own nursing home bill. So how is it fair if you ask Medicaid to pay your bill for you when you're simply transferring money to others? So that's what the look back is looking for, gifts and transfers. And if you have transferred money within that 5-year look back period, then you're going to be subject to what's called the penalty period. This is a period of time when you will be ineligible to have Medicaid pay your nursing home bill. This is Medicaid's remedy. Nobody gets sued, nobody's chasing you, not you or the person that you transferred money to. It's a question of eligibility. And the way we calculate, or the way Medicaid calculates this penalty period, is by using a regional rate, which is supposed to represent more or less the cost of nursing home care in your geographic area. So I put up the local regional rates there at the bottom of this slide. You can see New York City, Long Island, and Westchester. So here I'm giving you an example of how we calculate the penalty period. So in my example, mom had $220,000 in savings. She's decided to transfer $205,000 to her daughter, and she kept $15,000, so she's below the Medicaid eligibility level. She's Medicaid eligible. However, she transferred money within that 5-year look-back period. So she is subject to a penalty, a period of ineligibility. And down at the bottom of the slide, you can see the calculation of the period of ineligibility. We took the amount of the transfer, $205,000, and we divided it by the regional rate for Westchester County, because in my example, she's a Westchester resident. And we see that she is subject to 16 months of ineligibility. So one thing to notice here is that, imagine that she's in a nursing home where the monthly cost is $15,000 or even $20,000 a month. If we multiply 16 times 15,000 or 16 times 20,000, we're going to come up with a lot more money than the 205,000 that was transferred. So Medicaid's way of dealing with these gifts and transfers is a powerful remedy for Medicaid. Before I go on, does anybody have any questions so far? I want to make sure everybody understands how this look back is applied.
So we do have one question that came in, and the question asker would like clarification on the difference between community Medicaid and nursing home Medicaid, or they're saying individual Medicaid, which I'm not sure what that means. But I think they're asking about the difference between the application as well as the services.
Okay, well, I was just about to say show everyone what community Medicaid is, but nursing home Medicaid is nursing home. You know, you're in a nursing home and you want Medicaid to pay the nursing home bill for you. And as you know, or as I just said, nursing home bills are a lot of money, and It's the kind of cost, you know, $15,000 a month or something like that, that, you know, really will deplete most people's assets in a relatively short period of time. So for the nursing home application, again, we have the look back, which means that you must disclose in your application all of the financial information for the preceding 5 years. So for each bank account, you need to provide Medicaid with 60 monthly statements, 60, so that's 5 times 12 months, and that's for every account. And it includes every account that you have, bank accounts, accounts with brokerage firms and other financial institutions, your insurance policies, everything that really pertains to your financial life. And it can be quite burdensome and challenging to put this application together. In our firm, I think the record has been one client who had 92 bank accounts. So imagine 92 bank accounts times 60 monthly statements. We needed a wheelbarrow to deliver the application to Medicaid. So let me move on here. I want to talk about community Medicaid now, and also responsive to the question that Sarah just passed along. So this is community Medicaid. It's a very big and robust program in New York. You know, maybe the biggest component is the home care, but we also have adult daycare. We have assisted living. You know, many people are surprised to see that assisted living is part of community Medicaid because they think of it as more like a nursing home, but assisted livings are facilities that are more like apartment buildings with amenities geared to seniors, where you have dining rooms and organized activities and field trips and so on. We also have these assisted living facilities under Medicaid's ALP program. You'll see assisted living program. We have a lot of special needs programs for specific medical issues like traumatic brain injury, kidney disease, MS, and so on. Obviously medical and hospital care, physical therapy, occupational therapy, and so on. Again, a really big, robust program in New York State. Not so in other states. You know, you'd find that other states have no home care program to speak of. Really surprising. Whoops, let's go here. So Medicaid requirements for home care. Again, it's the same focus on resources with the maximum this year in 2020, $15,750. But now Medicaid recognizes that you need your income to live on. If you're in a nursing home, it's different because you have your shelter, your food, your medical care, your activities, everything is included. But here in the community, you're living at home, so you still have rent and mortgage and co-op maintenance and utilities and food and clothing and so on to pay. Nevertheless, the income limit is low. It's always been low. But here we have a choice and an opportunity. We can contribute our surplus income. That would be the amount that comes in each month above the $895. We can contribute that surplus to the cost of care, or we can join what's called a pooled income trust. This is a special trust to protect the surplus income of people who are on Medicaid. I'm not going to talk a whole lot about that today. We go into that in another program about Medicaid. I don't think I have time to really go into it much today, but just be aware that you don't have to give up your income in order to receive Medicaid home care benefits. So here's the main focus of today's program, which is that currently, and you know, it's always been this way, there's no look back for community Medicaid. So if you have transferred assets to a trust or to family members or friends, it's really not relevant to your application, because what Medicaid is asking you when you apply for community Medicaid is how much do you have in the way of resources right now as of the date of your application. So if 2 years ago you transferred money, as mom did in my example, that would not be relevant to the application. But what's coming under the budget that was passed last month by the New York State Legislature, beginning on October 1st, for the first time in New York, we're going to have a look back for community Medicaid, and it's going to be a 30-month look back. As you saw, the look back for nursing home care is 60 months. They decided to make the look back for community Medicaid 30 months. So there's an opportunity, I think, here, and an urgent one for those of you out there who are thinking about applying for Medicaid or have family members that may need Medicaid home care. You know, if that's the case for you or friends or family, now is the time to apply for it when you can still apply under the current and existing rules, because in October it's going to be a whole different story. Sarah, I see you. Do you have another question there for me?
I do. So we have a question asker that says, when does the penalty period start? The date of the application or the date approved?
Well, that's going to be a good question, and it's one that that I think hasn't really been answered yet. There are a lot of unanswered questions about the look back, and I'm going to talk more about that in one moment. One of the successes, if you want to look at it that way, of advocacy while the legislature was considering these changes to Medicaid was to preserve the some of the exemptions we have, like spousal transfers and spousal refusal, other transfers to blind or disabled children, or to a trust for the sole benefit of a disabled person. So these exempt transfers still exist. And again, this is one aspect where I put in the friendly category of New York law. Most states do not allow spousal transfers and spousal refusal, which allows someone who needs care to transfer all of his or her assets to a spouse and then apply and be eligible for benefits. So here's the thing that is, I guess, responsive to the question that Sarah just posed. We really don't know yet how this look back and penalty is going to work in the community Medicaid context, because all we know is that there's going to be a look back, but no implementing rules have been established. We don't know how a penalty period is going to be calculated. We don't know when it's going to start. We know in the nursing home context that you have to be in a nursing home and otherwise eligible for Medicaid, in other words, have less than $15,750 in assets, and then the penalty period would start if you've made transfers in the look back. You know, how that concept gets imported into the community setting, it's not really clear. You'd think that maybe it would be when the services start, but until they publish implementing rules, we really don't know. So on this slide, I've put up some possibilities. Again, they're only possibilities. Some of my colleagues have suggested that the regional rate for calculating the penalty in the community context might turn out to be the same as the regional rates for nursing home care. Well, that's one possibility. Another possibility might be that Medicaid would use the amount of money they pay to the Medicaid long-term care agencies for each person that the agency is taking care of. That's called the capitation rate or partial capitation rate. Or the penalty could be based on the actual amount of services or number of hours provided to the individual Medicaid recipient. I think that last idea is probably the least likely because it would be the most complicated to implement. And you can imagine that once these rules are set, that it's going to cause even more delay at the Medicaid offices, at the Department of Social Service and Department of Social Services offices around the state and in New York City, because they'll be dealing with brand new rules. It'll be more work. They'll have more paper in front of them, and I think these caseworkers are really going to be overloaded. And I don't know that the budgets are going to allow for hiring at this point and training new caseworkers. But we'll see what happens. So again, here's a slide where I've looked at the couple of the possibilities for calculating the penalty period in the community context, the home care context. So in my example, mom needs home care in October of 2020. She transfers $205,000 of her 220 to get under the eligibility level of $15,750. Her transfer of money is obviously within the 30-month look back. Would not be a problem currently under current law, but under the new look back, it will be a problem. If we apply the Medicaid regional rate for nursing homes, the $12,805 there at the bottom of the slide is the regional rate in Westchester County. So I've divided the amount of the transfer, $205,000, by the Westchester regional rate, which resulted in 16 months of ineligibility. Now, if Medicaid went to the other idea that I put up of using the MLTC capitation rate, which is approximately $4,000, that would result in 51 months of ineligibility. So I think you can see no matter what Medicaid decides to do here in terms of implementing rules, Medicaid is going to be imposing a lot of costs on the individual that previously were covered under the Medicaid program. Here's just a quick look at income, which is going to be unchanged. In my example, mom had income of $2,895 a month. The Medicaid limit is $895 a month. Therefore, she has surplus income of $2,000 a month. The choices for mom at that point are contribute the $2,000 to the cost of her care. If she needs $5,000 worth of home care every month, she pays $2,000 and Medicaid pays the rest. I'm sure most people would not be very happy with that solution, leaving themselves only with $895 a month to cover all living expenses. So we're going to look to the pooled income trust, which would allow you to keep that money and use it for your living expenses. So let me just stop there and see if there are any questions. Sarah, have you got anything this far?
We do have a question. Thank you, David. So the question asker says that my partner has dementia and I've been depositing most of her monthly income to my checking account to pay for our joint expenses. Would a countable transfer be the excess, if any, of what I deposit, and what our actual joint expenses are? If so, would I have to prove that there had not been any excess? So I think the question is, what is excess income, and to clarify that living expenses are not budgeted by Medicaid, that it's just dollar for dollar. I think that that's what the question asker wants you to speak more to.
Yeah, well, you know, Medicaid isn't really looking at your expenses or your budget. It's not their concern. Really, the focus is just on your income. So if the partner has, let's say the partner has $2,895 a month, if he or she is on Medicaid and receiving Medicaid home care benefits, that person is only going to be able to keep up to $895 a month in his or her bank account. The bank account can be a joint account, you know, that's not the problem, but that person can only keep $895 a month in his or her own account. The surplus amount, in my example, $2,000, you know, that would have to go into the pooled income trust or a pooled income trust. And from there, it can be spent on living expenses. So I wouldn't foresee any problem in that money being used to pay the rent, for example, or pay utilities. But I think you're going to need to work within Medicaid system. They're really not looking at your budget. It's not part of the analysis.
Thank you, David. And we also have one other question, which I think we're going to ask the question asker to address offline, but it was asked anonymously. So the question asker says, do these look back rules apply for community Medicaid for minors? But I think that since it's a different program, it's best that they re-ask their question with an email address so that you can address it off program. Is that correct?
Yeah, that's fine. Yes, I think so.
Okay, so anonymous attendee, please either put your question into the Ask Us button on seniorlawday.info or send us your email address so David can get back to you offline. And the last question we're going to take right now before David moves on is, when do you set up the trust? And I'm going to assume that means the pooled income trust that David just spoke about.
Yeah, so for clients who my firm is assisting with their Medicaid applications, we're setting up the pooled income trust at the same time that we're preparing and submitting the Medicaid application. And when you submit a Medicaid application, what you're looking for on the income side is what we would call a zero budget, meaning we don't want to have to contribute anything to the cost of care. We want to preserve the monthly income so that it can be used by the person to pay his or her expenses. And by the way, expenses are broadly defined. As long as you can show that the money is being spent for your benefit, it will be approved by the trustee of the pooled income trust. So it's not limited to necessities. It really is more, you know, whatever it is that might benefit you. Now, obviously, we're going to start with the necessities. You want to pay your rent first and your utilities and your food bill. But, you know, after that, if there's more money there and, you know, you want to buy new appliances or a new TV set or a new computer or whatever it is that you need or want, it's your money. You can spend it the way you want to, as long as you're spending it on yourself. That's the big restriction with the pooled income trust, is the money is there for you. It's not to spend on others. Okay, let's move on to a couple of other things that that came up in the budget that are going to change the way our Medicaid, our community Medicaid system operates. So we've been looking at the financial side of eligibility, and now we're going to look at the healthcare side of eligibility, because obviously if you're asking for a home care or some other benefit under the community Medicaid program, it's because you have a healthcare need. And the home care program is based on assistance with what's called the activities of daily living, or ADLs. Things like being able to get out of bed and dress yourself and go to the bathroom yourself, bathe yourself, cook a meal for yourself, and so on. So under our current rules, when you're evaluated, and this would apply, I think, both to the Medicaid long-term care agency or to the consumer directed program. I've abbreviated there as a CDPAP, which stands for Consumer Directed Personal Assistance Program. That's where you select your own aid, your own home aid, and then Medicaid pays the aid on your behalf, whereas the MLTC program is one where your aid is supplied by a long-term care agency, a home care agency. So in either case, you're going to be evaluated for what things you need assistance with. You know, what can you perform for yourself of the activities of daily living, and where do you need assistance? For example, if you're a fall risk going into a shower or a bathtub, that's an activity of daily living where you would need assistance. If you were a risk to cook a meal, you couldn't do that. It might leave the stove on and burn the house down. That would be another ADL. So under the current rules, we need assistance with 2 or more of the activities of daily living. And now they are, as of October 1st, we're going to need assistance with 3 or more of the ADLs in order to qualify for the home care program. And this is going to hurt, I think. Imagine that your mom or your dad or you need assistance in the home with bathing, for example. You're a fall risk. You know, unless you can show need for 3 or more ADLs, you may not get any assistance. One of the things that was preserved was that patients with Alzheimer's disease or dementia will continue to need assistance only with 2 or more ADLs. So I think this is, again, an important development here. It's going to exclude more people from the home care program unless and until they show they need assistance with more of the activities of daily living. And another important change, I think, is the use of a physician selected or approved by the Department of Health. And this is worrisome, I think, because obviously your own physician knows you. You may have gone or probably have gone to this physician for many years. The physician may be or may have expertise in your particular health issue or medical issue. Whereas the Department of Health physician who's appointed to evaluate you obviously doesn't know you, has no history with you, and really may not have experience and medical knowledge of the particular medical issue that you have. So again, another significant change that may result in fewer people being eligible for the Medicaid program, and this is what's what's concerning us, all of us in the elder law area and the healthcare area. So that's really the end of my presentation today. I hope I didn't run over my time limit there, but let's turn it over to questions at this point.
So, David, this is a interesting question. The question asker says, how many activities of daily living are there? Maybe you can address some of the main ones because there are a lot.
Yeah, I guess, the main ones are transferring. So your ability to, get out of bed and move from one room to the other, or get out of a chair. Toileting, ability to go to the bathroom yourself. Bathing, cooking, eating, and I guess some other household type of things. So those are the main ones. And of course, I think the main concerns are, particularly the transferring and bathing and toileting, are the ones that I think come up most and are most problematic. If you have problems, you really do need care and assistance.
Okay, thank you, David. So how much time typically elapses between the application for a pooled income trust and the approval of that trust?
Well, it's really not the pooled income trust that holds things up when we're applying for community Medicaid. It's always at the Medicaid office at the Department of Social Services. The pooled income trust can go pretty quickly. We really just have to make sure that we've got an accurate calculation of the monthly income so that we know how much is surplus. And then there are a number of pooled income trusts that are licensed to operate in New York State. So we're going to select one that meets the client's needs or help them make a selection. They need to sign an agreement to join the trust. It's called the joinder agreement. And then they'll start depositing their monthly income with the trust. So, again, that's really not, there are logistics involved with the pooled income trust, but in terms of the delays in getting approval and moving forward with the Medicaid paid benefits, it's always on the Medicaid side when we're waiting to get approval. But people should be aware that you have the opportunity to ask for reimbursement of out-of-pocket expenses going back to the date of your application, and even beyond 90 days prior to the date of your application if you were eligible. So if you've been paying for home care out of your own pocket, you can ask for reimbursement. Reimbursement, though, is always at the approved number of hours at Medicaid rates. So typically the reimbursement amount might be less than you actually paid out of pocket, but would still be a substantial portion of it.
Okay, and also, David, to just elaborate on that, regarding reimbursement, it can only be from a licensed home care agency, not a person you're paying off the books. Is that correct?
Yes, and thank you for mentioning that, Sarah. You do need to work with a licensed home care agency, and it's not only paying off the books, it's even working with the private aides or agencies that are not Medicaid licensed. And by the way, I know a lot of people do pay off the books. Really not a good idea. There are all kinds of problems that can result from that. And, the ones that, that I find particularly troublesome are, lack of workers' compensation insurance, disability insurance. God forbid your worker gets injured on the job. The penalties that you may face are absolutely draconian. And then, of course, you have other issues with Internal Revenue Service or possibly Immigration Service. Really not in favor of, cash off the books. Not a great idea.
Okay, thank you, David. So we've got a lot of questions coming in. So hopefully we'll have time to address all of them. So the next question is also about pooled trusts. And the question asker says, is the pooled income trust used only by individuals who don't have a capable family member to help us?
No.
No, it can be used by, anyone who can show any level of disability who has surplus income.
Right, so there's no correlation between having capable family and needing the pooled trust. It's just that you have income over $895 and you either need to pay your income to Medicaid or put it in a pooled trust, if I heard you correctly.
Yes, absolutely. Your family members are not under any obligation, legal obligation to come to your assistance. Children, nieces, nephews, whoever we're thinking of, no, they have their own lives. They have no obligation here. And frankly, I think it's more often the case that, spouses or others in the family try to help out and may put themselves in jeopardy. And I'm thinking of their own health care, where you're not really equipped to, help somebody who's falling or has fallen, other things like that. And, we've seen far too many instances where family members have hurt themselves trying to be of assistance. I really think the better idea is to have professional assistance.
Thank you, David. So going back to the whole October 1st change in the law, the question asker says, are there concerns that the infrastructure needs to implement these changes will be in place? Is there any chance that an October 1st change will be delayed?
Well, I suppose that's always a possibility, but this is that's in the budget. So I would expect that Medicaid is going to make every effort to comply with that. Now, maybe the issues and exigencies arising from the coronavirus are going to mean that things get delayed. I don't know. I mean, there's always a possibility, I guess, but I don't really know how to define that.
Right. Thank you. I heard that as long as New York State is in a state of emergency, that they won't change the rules for October 1st. But if we are not in a state of emergency, that's the expected date for everything to happen. So it really depends on how New York State does with the virus. So the next question is, how do you determine when to start a Medicaid application if you have long-term care insurance too?
Well, if you have long-term care insurance, Medicaid's going to require that you use your insurance. This creates some interesting issues. A lot of people have long-term care insurance and they think that's fine. And this comes up a lot for us in the planning stages. And if you have long-term care insurance, I think you really need to look at the sufficiency of the insurance and how it fits in with your personal financial situation. So, typically the insurance benefit is not going to cover 100% of the cost unless maybe we're talking about a small amount of home care or maybe even a larger amount of home care. But when we start to get up into the area where we're certainly nursing home, most people aren't insuring for the full cost of that. But even, if a lot of home care is needed, you may not have adequate insurance to cover all of that cost. So then the big question becomes, where is the money coming from to fill the gap? And it's always concerning when people say, well, you know, gee, I don't know, I guess I'm going to have to take money out of my savings. You know, that suggests to me that the insurance really wasn't thought through very carefully to begin with. The whole idea of it, I think, is to protect your capital, your assets. And if you wind up, you know, depleting your savings, even though you have long-term care insurance, then in my mind, something went wrong in the calculation of how much to buy or whether you should have bought it in the first place.
Thank you, David. So we have about another couple minutes for questions. So the questions that we don't get to, I know you've agreed to answer them offline. So if you have submitted a question to us and we don't address it during this program, don't worry, David will get back to you after the program. So, but I'm going to try to get through all your questions. So what happens to a surplus income amount after the recipient dies?
Well, that's one of the, I guess, well, depending on how you look at it, unfortunate aspects of the pooled income trust is, and it really is not so unfortunate. The money's going to go to charity. It's going to be the charity that's supported by the particular pooled income trust that you joined. So I guess you really want to think about spending that money while you can. And for that matter, it's not only when you die, but if you go into a nursing home, that money is no longer available to you either.
Okay. So is there a maximum monthly income to qualify for community Medicaid, or can I just put anything over $895 in a trust?
You can put anything over $895 in a trust, in a pooled income trust.
Thank you.
So your income, again, is not going to disqualify you from being eligible for Medicaid. Now, you know, there is an upper limit in the sense that for some people it may not make sense to apply for Medicaid when their income is so high, you know, where you're putting so much money into a pooled income trust that you can't spend it. There's nothing to spend it on.
Thank you. So I'm going to take another 2 questions and then turn the program back over to Elena, and that everyone else, because we have so many great questions coming in, we will get back to you offline after the program. So the next question is, my mother's Medicaid renewal is due for July of this year. Will any of these changes affect people who already are receiving services and already have a pooled trust? Is anyone grandfathered in?
Well, for right now, Medicaid's not even processing the recertification applications. You know, the latest word we've had with all of our cases is everything is just continued. And, you know, there is an interesting question, though, whether in the future with the 30-month look back, whether that's going to be applied with these recertification applications. So I guess, you know, if somebody during the course of the year had received money from an inheritance or a gift or something and then transferred it out of their bank account, would that come to light in the recertification because Medicaid is now applying a look back? I don't know the answer to that question. I think we're just going to have to see how these rules are implemented.
Okay, so we have time for one more quick one, David. So can I use long-term care and Medicaid at the same time?
Yes.
Okay, I knew that was going to be a quick answer for you. Okay, so since that one was so quick, we do have a question asker who's talking about how to find a Medicaid-approved doctor and submitted their email. And we're going to connect you with a geriatric care manager, social worker after the program who can talk more about the specific medical aspects of that. So thank you for for that question. And let me just see if there's anything else. Oh, we have a comment saying, thank you so much, Senior Law Day Collaborative, for the program. Great program, Mr. Cutner. Our answer is thank you very much, question asker. Okay. And so the last real question we have is, can my mom transfer the $200,000 she gifted back and not have a penalty period applied? And then our question asker says, thank you, David, so much for this informative presentation.
Yes, you can give the money back.
But then also she's not at the Medicaid levels, is that correct?
Right, so then she wouldn't be eligible.
Right, so if you have questions about that offline, I'm sure that David would be happy to address further what can be done to help your mom.
Right.
Okay, so David, thank you so much for joining us today. I'm going to turn the program back over to Elena. The recording will be available up on our website in just a couple days, so you can rewatch David every day if you like. And thank you so much for joining us. And we'll address all the other questions that are just continuing to come in offline. So Elena?
Sure. No, David, thank you very, very much for what has been a very informative conversation. Because you were lovely in answering all the questions that were raised. Again, for all of you who were not able to get your questions answered or who have a question after today's event, please know that you can go to seniorlawday.info. That website is available for you. The webinar and the presentation materials will all be posted. We usually get them up pretty much the next day, so we'll work on doing that. And there is an Ask Us button on that website that will allow you to ask any question that comes up in the coming days, weeks, and months. Also at that website, you can find out about next week's webinar, which is going to be titled Scammers Follow the Headlines, What to Know and What to Beware. We are delighted to have Gary Brown, the statewide elder abuse coordinator from the New York State Office of the Attorney General, give that presentation. For those of you who have come to our annual Senior Law Day events, you know that you always find out about something you are definitely wish you'd known about a little bit earlier. So go to that website, you will see the registration link, and if you're on our mailing list, we'll also send that out to you. Thank you very much for attending.